Well, you know, we've come to Singing River Health System so many times and saw some of the great programs they have here, the wonderful surgeons that we've met, and we're here today talking to Dr. Tassan, who is with the, he is the interventional cardiologist, and he's the co-director of the foundation, of the structural heart program here at Singing River Health System, Ocean Springs Hospital. Dr. Tassan, good to see you.
Thank you.
If you would, tell us a little bit about yourself first.
All right, well, I was raised in Cleveland, Ohio. I did my training at the University of Kentucky, and I pursued a cardiology over at NYU Winthrop, just outside of Manhattan on Long Island. I did an additional training in interventional cardiology, which included some pretty extensive hands-on training with structural heart disease, and basically came here roughly about 1 year ago to kind of help spearhead the growth of the structural heart program.
Now, you've got some really groundbreaking technology here. Every time I come here, it's something new, and it's just like a kid in a candy shop, even though I don't know nothing about it. But hearing the doctors explain it, talk to us about the structural heart program and the hybrid operating suite that you have located here at the Ocean Springs Hospital.
Basically, this is a state-of-the-art hybrid catheterization lab, which is one of a kind on the Mississippi Gulf Coast, which is basically a cath lab that, in a given moment can be converted over into an operating suite. And basically it is a unique cath lab for the area and allows us to deliver more expedited care if necessary during some of these complex procedures.
Now, I'm sure that you see them from one range to the other as far as cardiology problems. Is there any one type in particular that this structural heart program that you work with?
So basically, some of the things that we are able to do within the structural heart program here at Singing River Health System is basically one of our staple treatments is something called a TAVR, which is a transcatheter aortic valve replacement, is where we're actually able to replace an aortic valve through the leg rather than doing open heart surgery. And we take a team approach. We just don't say everyone gets a TAVR. We have a structural heart committee that's basically made up of interventional cardiologists and surgeons, and basically review cases on a weekly basis. And if we deem necessary that this is the appropriate treatment to do an aortic valve through the leg rather than open heart surgery due to patient being elevated risk for a surgical complication, and that is something that we can do in this room.
That's because, whenever you talk about having open heart surgery or something like that, first thing the person thinks about, they have to bust me open, split you wide open and do that. But now with the technology, go up through the leg. Yeah,
and there's also other things that we can address. One of the other treatment options that we have is actually for the mitral valve. We have something called a Mitral Clip that we do here as well, and basically going up through the groin leg area, we're able to access the heart and actually put clips onto the mitral valve if it's deemed too leaky and causing patients to have profound symptoms such as shortness of breath or congestive heart failure if they're not a good surgical candidate, which occurs once you get into a certain age.
Right. Now, how would someone know if which one of these surgeries is going to be best for them?
Well, basically, it's having good follow-ups and regular follow-ups with a cardiologist or primary care physicians, and basically staying attuned to your symptoms and not ignoring them. Unfortunately, sometimes we see people who ignore their symptoms, and we get to the patient a little bit. It's not that it's too late per se, but it could have been treated earlier before the patient became too symptomatic.
Okay. Well, you've got a new type of procedure too. I believe it's called the Watchman.
Yes, it's a fantastic device, and Dr. Cunningham, who is the other co-director of the structural heart program, is going to dive into that more as well.
Okay. Dr. Cunningham is also co-director of the structural heart program here at Singing River Health System, Ocean Springs Hospital. Tell us about what exactly is the Watchman. I mean, I've seen the movie, but it's probably not anything like the movie.
Yeah, no, it's nothing like the movie. So the Watchman is a small device that we place inside of the heart to prevent stroke in patients who have a condition called atrial fibrillation. So atrial fibrillation is a very common condition, especially as you get older in life, and is the most common cause of stroke in this country and in most places of the world. And most patients need to take blood thinners to prevent the stroke. And so several years ago, a company developed a device called a Watchman, which kind of looks like a parachute or a jellyfish. Not sure if it's visualizable here, but it's essentially a metal frame with a little mesh over the top of it that seals off the little appendage that's inside the heart where most of these clots come from that cause the strokes in the atrial fibrillation patients. So it's sort of an embryological remnant. It's not important for the function of the heart, so it's safe to put a device in there to close it off. And we know from multiple studies that most of the strokes that from atrial fibrillation come from this area, about 90 to 95% of them. And so closing off that, in theory, should prevent strokes. And if you look at the studies that have been done on Watchman, that has indeed been the case. It is equivalent to blood thinners as far as its ability to prevent stroke. It also has been deemed very safe going back through.
I was going to ask you, how safe is the procedure?
Yeah, so it's been implanted in about, I think last I checked, it was over 60,000 patients have one. And it has a 98.5% or so success rate on implantation and about the same procedure-free success rate as well, so about 1.5% complication rate. And the advantage of it is that patients have far fewer bleeding events because they don't have to take blood thinners anymore. We've done a lot of them here since we started putting them in last year.
Right.
We've had a lot of success with it so far, and it's going to become a very, very common cardiology procedure.
What are some of the other benefits? I mean, how long does it take to do one of those?
Yeah, so it takes about an hour to have one implanted. You do have to stay in the hospital overnight to have one. You do have to have a little workup ahead of time to make sure you're a candidate.
Right, I was going to ask you, how do you tell if you're a candidate?
5% of people, their appendage is either too small or too large to have one.
Okay.
And so, that's going to change. We are going to be one of the three centers in the South that have this new device that's coming out. Should be next month, which is the newest version of the Watchman. And it is going to be able to be implanted in about 98 to 99% of patients.
Wow,
So
that's amazing. Yeah, again, as I mentioned earlier, just coming here to Singing River Health System and talking to the different doctors and surgeons, it's just it has not ceased to amaze me, the technology and how well Singing River Health System stays on top of all the technology that they have here. And we've talked to so many of the different surgeons that they had. But thank you, Dr. Cunningham. I appreciate it. And of course, if go see your physician. If if you are having some issues, or before you have some issues, if you're in that group, and find out if you are a candidate for the Watchman or any type of the other surgeries that we've talked to with him and Dr. Tassan here at Singing River Health System, the Ocean Springs office. Go to the website. I've got a whole bunch of information on there for you.